Welcome back to the iHuman orientation. This is video 2 of 3 of the iHuman orientation. On this video, we will focus on iHuman case play. The learning objectives of this portion of the video series are to review the iHuman website resources, know the technical requirements, play a case, understand how to troubleshoot problems, and complete a case play walkthrough. The iHuman website has lots of good resources, including a frequently asked question area. It has the cases themselves and support links. We'll go to the iHuman website now. This is the home page. It is at i-human.com. Once there, go to log in. It's going to log me directly in because I was already logged in, but you would enter your email address and password to get to this page. Let's start with the User Support Center. This is where the frequently asked questions are, which you can browse by topic, or you can type in your question here and it will give you a list of answers. You can also submit a support ticket here. They have very flexible hours, especially Monday through Thursday when they're open 24 hours a day. They have slightly shorter hours on the weekend. To submit a support ticket, you go to that link and it will bring you to this page where you can submit your ticket. They get back to you quite quickly and can certainly help you figure out any problems. If you're having persistent problems or you're not getting an answer from iHuman, please don't hesitate to email me or call me at the available email address and phone number that you've seen in the initial orientation. Going back to the iHuman page, you can see here that there are some quick reference guides as well as some how-to guide videos for the different sections of a case. These are playable at 1.5 times speed to save you some time. Your cases will be found under this tab. You'll receive a case calendar at the beginning of the month from the coordinators that will determine which cases you will be assigned and when they're opened and when they will close. I won't be going into this area right now because it shows all the final diagnoses because this is my instructor page. Going back to the PowerPoint, the next topic is the technical requirements. iHuman recommends that we use Chrome, the Chrome web browser, for this program. Other web browsers will work, but they often have slowdowns or flaws, and it's just best to use Chrome. For those of you with Macintosh computers like myself, make sure the scroll bar settings are adjusted so that your scroll bars are always visible so you're not confused about how to work through the program and the cases. In order to do that, you go to the Apple menu at the top left, select the System Preferences, then General Preferences, and then under the Show Scroll Bars area, select the Always option. Remember that for the highest fidelity, you should use your headphones, especially during the physical examination. Treat your headphones like they're your stethoscope in the clinical setting. These will give you a much better idea of the finer sounds that you're hearing so that you can detect things like RALs on lung exam or an S4 on the cardiac exam. Now we'll go back to the iHuman website and look at doing a case. Now you're likely in orientation with me right now, and what I'd like you to do is go ahead and log in to the iHuman website. Once in the iHuman website, go to Cases and go to the practice case, which is Doug Winters. This case can be played multiple times, and we can use this to walk you through the program. So I'm going to go to a different case rather than Doug Winters. And Let's start by demonstrating the main buttons on this first page after the case is opened. So up here at the top left, you'll see that you can get case instructions, play a case, look at who wrote the case, get help, get iHuman support, and close a case from this 3-bar tab. Now, the cases can be closed at any time. It does not submit your case when you close the case. It does actually, the program saves your work every 1.5 seconds, which allows you to be sure that your case is saved. If you're going to walk away and go and see a patient in the hospital or do some research on the case before you move further, it's best to close the case so that your timing and everything is recorded accurately. You can also change the font size with this toggle here. And over on the top right, you can click the question mark, which links you to the videos on the home page that we looked at before, as well as some keyboard shortcuts and the link to the iHuman support page. Looking at starting the case, you can see here that it gives you the patient, at their age, height, and weight, and their chief complaint. I'm going to click Start, and that will begin the case. And you can hear the patient breathing. You can see some anxiety on her face. So this gives you just an overall picture of who you're encountering. I'm going to mute the patient. Now, a lot of the buttons here on the top bar are the same. The first thing I'm going to show you on this first page is the Show Patient Record area. The patient record area is where you're going to record your H&P, and this is what I'm going to review to assign your grade. Once you go into the patient record, if there is any past history before this patient came to this visit, it will be here. You can see that she's had an annual checkup, no medical concerns. She has some eczema in the past, etc. So that may be available. Sometimes it is also included in these tabs. So take a look and make sure there's no information here at the beginning of your case that will help you develop a differential and come up with a diagnosis. You also receive the vitals here. We give you the vitals rather than making you obtain them. If you go back, you'll be back at this home page. Remember that you can go in and out of the patient record at any time to continue your documentation of your H&P. Now, let's look at the key findings and the differential diagnosis. Key findings are your problem list. So this patient, if we go to the chief complaint, I believe she was short of breath. So you can add dyspnea. And if you, as you're thinking of the problems and the potential differentials, you can add them here, and we'll do that as we go. Over here is where you'll ask the patient questions. Oftentimes you'll get this general appearance box first. You can close that to get it out of your way. And now you have the ability to ask questions. You should use this area to ask everything from your history of present illness to your past medical history, family history, social history, review systems, exam, medications, everything. You may find yourself wanting to come back to this area, which is fine, to ask more questions after you find out more information. If you find something on exam that triggers you to consider another diagnosis, you should come back to the history section to ask more questions, just like you would in a real patient in the hospital. For instance, if you found acute kidney injury on labs that you didn't know about on the initial presentation, you might come back here and ask about any causes of acute kidney injury that may be available from the history. So to start with, I'm going to use the input method of using the keyboard, but you can also speak your questions by clicking this button and using the natural language processor. So, why are you here today? So it gives me 8 options, which is a setting that we've determined. And you click on the question to get the answer. So why are you seeking help today? And she says, I've had a cough for the last 3 weeks, which has been getting worse. I've also had trouble breathing when I'm walking to my next class at school. I have to stop and take a break. This has been happening for 3 days now, and it's made me a little scared. So she has shortness of breath and cough, and I'm just going to, for my own benefit, put times 3 days. And we might want to say with exertion. Now, when you're typing these questions in, sometimes it's easier to type fewer words to give yourself more options. For instance, you might put fever rather than saying why or have you been having fevers. So we ask her and she says no. Now I'm not going to ask all the questions that are necessary for this patient. You'll be asking a lot of questions to obtain a comprehensive history and physical. I will show you some key points though. For instance, do you have any family history? So you can ask, for instance, are there any diseases that run in your family? She says both my dad and I both have mild eczema, but nothing else runs in the family, thankfully. So that may be considered plenty for you, but you never know if the patient understands what you're asking. So you use the word diseases, which is medical jargon and probably above the level of education of some of our patients. So you need, even in this iHuman, to consider what you're asking, and if you have specific questions about family history, you'll want to ask that specific question. So, asthma. So here I was hoping that it would have a question, does your family have a history of asthma? And it doesn't have that. If there's a question like this that you want to ask, but there's no way to ask it, you should add it to your HPI section or whatever section you're in, past medical history, etc., so that I know that you're interested in getting that question answered. There are other questions that you might ask that are available, but you'll have to ask them in a different way. For instance, think about the family history question again. I wasn't able to get anything with adding asthma, but I wasn't completely satisfied with the answer to the first question about her family history. Another way to put this is asking about the health of their family. So, tell me about the health of your parents and children. This is a much more appropriate jargon to use with a patient. And in this case, you get a similar answer. In other cases, you may get more detailed answers than you got in the first place. And this is key. When you're seeing a patient in the hospital, you'll often ask a question that you clearly feel you didn't get an adequate answer from. Or maybe you're suspicious that there's more to be found, and you'll ask the question in a different way. It's important in this case to do this sort of adjusting of your questions to be sure you're getting all the information. Another important point about the history section is there will often be a second person that you can ask. If there's altered mental status especially, there may be a husband or a wife, there may be a sibling or another family member, and you'll see pretty clearly that they'll have an option to click on the other person and ask them the same questions. So please don't hesitate to use that, and really you're expected to use that. Now I'm going to go ahead and show you how to use the differential diagnosis menu. Go ahead and add, and in this case I'm kind of worried just based on the initial sound of her breathing and her symptoms as well as her age that this could be asthma. So I'm going to put that here. And it adds asthma over here. You can close this out and come back and add more. You could say, I don't think asthma is it anymore, I'm going to remove it. You could put pneumonia here. And if you were just thinking it's unspecified at this point, you don't know if it's bacterial or viral, you could just put pneumonia. And then it's going to eventually ask you to put in your lead versus your alternative and must not miss diagnoses before you submit this. We're not to the point of doing that yet, but I kind of like to keep these keep in my mind which ones I'm thinking of as lead or alternative. So I'm going to put asthma as my lead, pneumonia as my alternative, and I'm going to put must not miss by pneumonia. You'll continue to add more problems and also more differentials as you go through and ask questions. Something we might put in here is no fever, right? Or we might add, just to keep ourselves on track, that there's no history of asthma in the family, but there is eczema. Okay. Now we're going to click Next to perform the physical exam. Remember, I'm not asking all the questions. You need to get a comprehensive history of present illness, review of systems, medications, allergies, past medical history, past surgical history, family history, social history, exam. So make sure you're getting all of that. I'm going to move forward, and now this is the exam section. I'm going to unmute her for a moment so that you can see what actually is happening. And you can turn the patient around. You can feel pulses by clicking this. And you can see over here that there's a help menu that tells you what all the icons are. We are not going to have you manually take the blood pressure, although I do think this is pretty cool. Here are the vitals. Again, we're giving you the vitals, and then the exam that you select over here will be shown here. You can do this in the head-to-toe fashion like this, or you can do it in an alphabetical order as far as how they're listed. This will give you all of the possible exams that you can do. And for instance, if you clicked Inspect Skin, it's going to tell you in this case that the skin is warm and dry, no lesions seen, normal skin turgor. If you pick, for instance, look in eyes with the ophthalmoscope, it's going to give you an image of the retina. Oculomotor testing, pupillary testing. So you have the option to do every type of exam that you've been trained to do. What I recommend is that you do your exam in a comprehensive but concise fashion. If an exam is necessary to rule in and rule out a diagnosis in a hypothesis-driven fashion, you should do it. If the patient is complaining of shortness of breath and you don't auscultate the lungs, you will lose points on your score. If a patient comes in with fever and altered mental status and you don't do a complete neurologic exam, or you don't examine for meningismus, you're missing significant potential findings that could bring you to a certain diagnosis. Now, whether you do them or not, I'm not going to look at. I'm looking at whether you document. This is the same thing that people in the hospital are going to look at. It's the same thing that lawyers will look at, and it's what you need to be documenting in your note. To look at how to auscultate the heart, you click here, and then you can listen to each area. I'm going to again take her off mute. Remember to put your headphones on when you do this. And then you can listen in each place. You can turn her around if you needed to for the lung auscultation. And you can, for instance, ask for dynamic auscultation, which will tell you narratively what the result was. You can auscultate the abdomen. As I was mentioning before, you can auscultate the lungs. And again, you can auscultate the back. And you can get mostly narrative answers for the neurologic exam. So this is the exam area. You might, as you're doing this, document, for instance, wheezing as a problem. And please notice this gearhead icon. This is where you ask questions. It won't let. This is where you answer questions, medical knowledge questions, and it won't let you continue until you answer these questions. I'm going to click through them very quickly just to move through it. And that was the only question for this one. If there are more questions, another one would come up. In this case, it's one of one. So I'm going to close this. And now I'm going to submit my history and physical. Now, remember, the entire time you can go back to any section and do more. This is just submitting what you've done so far. And I can go back and do more physical exam. I can go back and do more history questions. And I can always go back and add more into my HPI and the rest of my H&P. So moving back to assessment, it's asking me now to sort this list into the most significant active problem. I'm going to say it's the shortness of breath for 3 days. And I'm going to say the cough is related. You could pick unrelated or unknown in this case, since there's no fever, no history of asthma, unknown, or maybe past medical history. And then this wheezing is related. I'm going to submit my key findings. And now it asks me to write my problem statement. So this is just like your assessment in your assessment plan. So 16-year-old female presents with cough and shortness of breath for 3 days. And obviously you're going to find out more about this patient than I have and you'll have more to put into this problem statement. So it says you must commit your differential diagnosis on the left-hand panel before ordering tests. So I've moved to choose tests, but I haven't submitted or committed to my differential diagnosis. So I'm going to click OK, and then I'm going to either add or subtract from my list over here, and then when I'm ready, I'll go ahead and click Commit. Now it puts my differential diagnoses that I've chosen over here. And now I can add tests that I want to order. Now, it's going to allow me to type in here. So CVC, I'll click this, and then I want to add it to asthma. So I'm going to click plus, and I also want to add it to pneumonia. So I put it there. Now watch this. I put in CXR for chest x-ray and it's not available. So this is no different than any electronic medical record that you've used in the hospital. Some things are not searchable in the way that you're thinking they should be searchable. So this system is no different, and it's not entirely intuitive. So consider another way to put it. So chest, and then you get an AP, a PA, PA lateral, chest CT. So I'm going to say up front I'd like a PA and lateral. And I'm going to add that to my pneumonia differential. And then she's short of breath and has this cough. Let's say I want a 12-lead EKG. I'll add that to other tests. Now let's say that you want to order a urine pregnancy test. So we type in urine, and there isn't one. I'm going to try it in a different way. It's not there. So if you come to that situation and you can't find a test that you want to order, your best next step is to go ahead and just add that into your assessment plan within the patient record, so that I can tell that you wanted to order another test that wasn't available. So you would just write, I wanted a urine pregnancy test, but that was not available. That's fine. So next, you've got your tests ordered, and you've committed to your differential diagnosis. Now you're going to review the test results. It's only going to give you the tests that you asked for, and it's going to tell you if it wasn't done that it wasn't recommended at this time. So for instance, an EKG in the 16-year-old was overkill. It's not recommended at this time. A CVC was not recommended at this time. The chest x-ray was. So it gives you a very nice image that you can blow up, and you can adjust, you can zoom in, and take a look at the chest x-ray. I would recommend that you go through your typical algorithm of the bones and the airways and the parenchyma and the ribs, the heart, etc. So make sure you go through your typical path to getting to interpreting your chest x-ray. Now, you're not done at this point. You can always go back and look at other tests and order new tests. So optional next step, order more tests or make the diagnosis. So I could go in and order more tests here. So I can also add other differentials. I'm going to go ahead and recommit. And then let's say I decided that I wanted a chest CT. I'm a pulmonologist. I want a chest CT. I'm going to add it to pneumonia, and I'm going to click Next Step, View Results, and well, look at that. It wasn't recommended. So that's pretty obvious, but anyway, the point is that you can go back and you can order more tests. You can add more to your differential, and go forward. You get up to 3 attempts at ordering the test that you want before you're completely out of test options. Again, I'll harp that you should go back to your patient record and add things to it the whole time. And if you found something new, like let's say we found a pneumonia on the chest x-ray, go back to your HPI and ask more questions specific to pneumonia. What if there's a travel history and this is a fungal pneumonia? Also go back to your exam and do further testing and examination specific to a pneumonia. You want to make sure, just like in the hospital, that you're considering all possible differentials and you're ruling those in and out with questions and exam in a hypothesis-driven way. So we're going to go ahead and click Next Step, Make Diagnosis. It says I have 1 remaining round of tests. I'm not going to do that, but you're welcome to. What is the correct diagnosis for this patient? So I'm going to click asthma. So it leaves you only with the differentials that you included here, and then you submit the diagnosis. And now it says your activities have been submitted for evaluation. So we're going to go ahead. It's got some gearhead questions here, so I'm going to answer those. I'm just going to click through these for time. And now we're back to this screen, so now we can write our plan. Now, for your plan, I want you to write a bulleted plan with your problems prioritized, and I want you to include a differential diagnosis for all active problems and a management plan for all chronic and active problems. That means if you put hypertension in the past medical history, you need to include it as a problem here. I'm going to go ahead and type in some letters here as my plan. I'm also going to go back to the gearhead and answer my medical knowledge questions. I've submitted those, and now I'm going to submit my plan. Pay attention to these warnings. They're telling you stuff that you might have forgotten about. And now we have completed this case. It says next step, submit and review case summary. Yes, I'm done. My patient record is now complete. I can't go back and add to it anymore, so be sure you've submitted everything to that before you click that last button. This case is assigned as a test, so you have to completely close out before you do any more, before you can review that. And all of your quiz results have been submitted, and there will be some references that will show you. A lot of times there's going to be a link up here for a case synopsis video. Those case synopsis videos are very good, and they'll take you through the case and how to ask the questions and how to approach them, how to consider the different causes, for instance, of acute kidney injury. Maybe it's pre-renal, maybe it's post-renal, maybe it's obstructive. And then those will be highlighted as a link here. You'll also be able to see references for the cases here, which are hyperlinked to PubMed IDs, and it will take you out to the right literature. So I'm going to click See Evaluation. And that takes me to the overall evaluation of your performance. Now, this is what's called the auto score, and you'll see in the third video that we're assessing you on your H&P alone, and on your H&P we're basing this on the RHIME framework. More to that once we get to the third video. Use this to help you understand whether you're asking the right questions, whether you're considering all of the differentials. But don't take this as your grade. This is by no means related to your grade. This goes through the time that you spent in each section and you can click on each separate section to see your feedback in each area. So there's a key up here. These are missed questions that were required by the case author versus questions that were suggested by the case author, and other ones that you asked that weren't required but weren't inappropriate, incorrect questions, etc. If you hover and click, you'll see what question it was that you asked right. These are the questions that you didn't ask that you should have asked. These are questions that are exam findings that we did but we didn't have to. If you go to the key findings problem statement, you can review what the expert wrote down as both key findings and the problem statement. If you look at the differential, you can see here that they liked asthma as well, but also were considering viral pneumonia, bacterial pneumonia, atypical pneumonia, pertussis, bronchitis, upper respiratory infection, and we did just basic pneumonia. So they're wanting more specific. This is pertinent to the auto score, but not pertinent to your overall score from our review of the case performance. Here is the test summary, so what tests you ordered versus what they wanted. This is the expert's management plan. I'll remind you again that we want a bulleted format just like in the hospital, so these expert management plans do not always go along with what we're expecting of you. We expect quite a bit more of a clinical management plan from you. And then your electronic medical record is here, where you will have filled out your patient record. I spend my time looking at EMR and management plan when I'm assigning your grade and your performance on the RIME scale. If you haven't completed these areas, then there's no way for me to assess that part of your EMR. And then finally, the questions, you can scroll through and look at each one and what was correct and incorrect. And that is the summary. Now, when you're completing the practice case, when you complete it, you're going to be able to see all this feedback, and you'll also be able to see feedback in the middle of the case because you'll be playing it in learning mode. So the expert feedback will pop up as you go through the case. Use that feedback to improve the questions you're asking, the exam portions that you're completing. But also, you're going to have access on Canvas to an H&P key that I wrote and was reviewed by multiple educators to be sure that we were including all the appropriate questions. And we'd like you to use this as self-assessment and immediate feedback on your completed H&P on iHuman compared to what we wanted to be there. This H&P key not only gives you what we wanted you to ask, and it includes why we wanted you to ask it, but also how to ask it. So there's 2 documents for that patient. One has tracked changes that show you how to ask it. It includes the question that we asked. And the second document is the same H&P key again for the practice case, but in that one it tells why we want you to ask what we asked, or why we want you to do that portion of the exam. So these are meant to be a way for you to get immediate feedback by comparing your own performance with the H&P key, plus you get the feedback directly from the iHuman summary that we just went through. I'm going to go back to the PowerPoint and conclude. So in conclusion, please remember to document the patient record as you would an H&P on your rotation. Go back, ask more questions, and document all pertinent positives and negatives in all sections of the history and exam throughout the case. Don't forget to do that. And do this in a hypothesis-driven way. What that means is when you see the patient's presentation, you're immediately thinking in your mind, oh, she's got cough and shortness of breath. Maybe she's got pneumonia. Maybe she's got asthma. Maybe she has a pulmonary embolus. And as you ask your questions, you're considering all those possibilities and things that would put her at risk of those problems. So do you have a history of asthma? Do you usually take inhalers? Have you been taking your inhalers? Maybe you're thinking about pulmonary embolus. Well, then you should be asking about whether she's on any type of hormonal therapy. You should be considering whether she's had a history of prior venous thromboembolism. So hypothesis-driven means that throughout this entire case, as you get more information, you're asking more questions and including those answers and information in your documentation to give me, the reader, the idea that you have considered all the differentials and interpreted this case, provided some management plans, and that way I know that you're doing an awesome job in your ability to be a diagnostician. Please call me or email me again if you have questions. That phone number and email address are available to you through Canvas or during the orientation. Thanks for listening, and one more video and we will be done with the orientation.